uploaded, brought to big centers of Punjab, and then the experts would look at that and send back the report in the evening, and they would get medical facilities. 3, I was able to, by the grace of God, build one of the finest hospital for kidney and liver in Lahore, which is probably the best in South Asia. And, poor people going to India, to China, expensive treatment, we offered them in Lahore, saving very, very, scarce foreign exchange and getting them free treatment who are poor, and we would charge who are rich. And this combination of cross-subsidy, we were able to provide facilities to the people. And then dengue, in 2011, it struck Pakistan, and most of all, it struck the city of Lahore. And he would bear me out. This dengue outbreak was probably the biggest around the globe. I have to confess here in front of this August Assembly, I didn't know much about dengue. Believe me, we collected experts, and then, from 6 in the morning till late night, I would have meetings. It was the entire government and civil society, philanthropists, experts, doctors, and common man. We all got them together. Went for lava, went for these brigades, would go out and find various lava and trying to finish them through modern techniques. It was a challenge of sorts. I got machines flown by aircraft and placed in hospitals, and HDUs we established in all hospitals, and I, through law, through a decree, made it, in all laboratories responsible to provide these dengue tests at a very meager cost. And that's how we were able to control dengue.
And that's an extraordinary thing.
Sri Lanka, just 30 seconds.
Yes.
Sri Lankans, they gave me a flashing sign that, Chief Minister, this year you will have deaths amounting to thousands of people. And I was dead scared. I couldn't sleep that night. But mercifully, through this collective efforts, only 250 people died. And next year, there were dengue patients, no death.
In Punjab, 100 million people? More than 100 million people?
140 million.
140 million.
Yeah, that's right, in Punjab. Yeah. And that became a test case around the globe, a study. I think this is how we can, achieve results through meager resources. But that does not mean that the yawning gap between global north and global south should not be arrested.
And I think what you've done there is really emphasize the on-the-ground work that you need to do. But of course, you also need finances. Your Excellency, Dr. Rabeeah, let me embarrass you a little bit by just pointing out the important role the Kingdom has played during the pandemic as chair of the G20, when it made significant contributions to finding new vaccines through support to the Coalition for Epidemic Preparedness Innovations, and making sure those vaccines are accessible to the most vulnerable communities in the world through Gavi, the Vaccine Alliance. KS Relief and the Kingdom has done extraordinary things. How has that impacted health outcomes across the world, and what more needs to be done to accelerate progress? I just wanted to ask His Excellency Dr. Rabeeah that question.
Well, thank you, Keir, and assalamu alaikum, everybody. What has been actually learned during COVID-19 is something that all of us should be careful with, that we don't repeat the mistakes that has happened because of the inequity and access and all of the challenges that has met us. And we know that it is very important that we should have a global coordinated response. We should have a global strategy. We should also have a very good communicated health system and also decrease the funding gap to support health facilities. Let me start with Saudi Arabia. Saudi Arabia has done many actually efficient programs, starting with the local programs, regional and global. At a local program, and in front of me, the efficient Minister of Health, my friend Fahad Al-Jalajel, they have done very effective programs, whether with the digitalization, whether with the access to care, access to vaccination, access to diagnostics, including illegal migrants that have received the full care in Saudi Arabia. This program has represented a local model that has been transported regionally and globally. At a global level, Saudi Arabia has been one of the instrumental supporter of, as you mentioned, Keir SEPI for the vaccination industry and other initiatives. We have also supported the equity of vaccine distribution through Gavi and COVAX initiative. And also, we have been doing a bilateral work at a regional level. More than 26 countries has received immediate support to support their health systems in the region and beyond. We have invested more than $900 million to support those countries and ensure that they have a very solid healthcare system. However, is that enough for the world? That's not enough. If we are going to face, God forbid, another pandemic, we should be ready to improve the global coordination process. We should also revisit our strategy at a global level. And in addition, that the funding gap, which is widening now, and we have heard the other two speakers clearly, should be improved by supporting how can we increase that. I will call in this meeting, we have governments, we have politicians, we have media. I think the conflict that is happening in the world are expanding and increasing, and these are consuming all of the funds for the health system. I call upon all of the politicians and influencers to follow the example of Saudi Arabia by mediating peace-solving processes to ensure that we save the money to help communities in need, and I'll stop here.
Thank you. And the point was made by the Prime Minister very clearly, I think, that by investing, you actually save money. You spend more money if you don't invest. So again, thank you for your contribution. Anita Zaidi, we saw that extraordinary video, really telling us about the work and what really struck me was the work of individual women in communities with individual relationships. Studies have shown that investing in women's health is in everyone's best interest, yet we still see big gaps in funding, research and resources needed to ensure women lead healthy lives. What's holding us back, and what solutions hold the most promise to close this gap?
Thanks, Keir, and assalamu alaikum, everyone. So let me comment on the video first, and then I'll get to your women's health gap question. So what you saw in that video in the opening plenary is the critical role that women play in the global health service delivery, whether it's eradication, whether it's routine health service delivery, giving vaccines out during COVID. The system relies on female workforce. And until recently, we haven't done, as a global community, a great job of understanding what are the issues that women in the frontline health workforce, which is actually now 70% of the global health workforce is women, what are the issues they face that helps them not deliver what we are looking for, such as getting polio vaccines to every child in remote areas, tough to reach areas. And so I've been very happy to see that the polio program has actually taken a lead in this, both at the global level and in Pakistan. And there is a national gender working group that looks at, okay, how can you improve working conditions to and understand what's happening at the ground so that women can do what we are expecting them to do in the polio campaigns. And so series of workshops, national surveys, and things that turned up were really interesting. Like, for example, no access to toilets during the whole working day was really hampering their efforts. Harassment. Not having ID cards that they could show that they were actually part of the official government response to polio. And so now co-designing solutions with women, frontline women health workers is really leading to a much better quality of campaign. So that's kind of what you see from that video, how women taking women's ideas on board can really improve a lot of the health issues that we see. Now, why is women's health focusing on women's health such a critical issue in general? So you talked about the health gap, and it's actually a very underinvested area of global health and a very underinvested area of global pharma R&D. And this underinvestment then results in some really startling statistics. So for example, Dr. Tedros talked about child mortality, like 4.9 million children are dying every year. Now that's huge progress over the last 20, 25 years, where child mortality has been, even though many more children are being born, child mortality has been cut in half. And we made huge progress in maternal mortality during the MDG era. But in the last 10 years, we have made no progress. 200,000 women are still dying from pregnancy and delivery-related complications every year.
That's so disappointing. So why is that?
Yeah. So the reason is underinvestment in both R&D and innovations for women, and then underinvestment in the health systems. And addressing both of these is critical. And there's lots of things that we can do. So for example, I'll give you the postpartum hemorrhage example, which is the most common reason that women die during childbirth. Until recently, the gold standard for diagnosing if a woman was having excessive bleeding was that you would eyeball the amount of blood that was on the floor, okay? And say, okay, this looks too much and maybe I should do something. We invested in a very simple drape, a calibrated drape that is a plastic drape that has a sleeve at the end of it, a pocket that can collect the blood and tell you if it's above a certain threshold. And just doing that simple innovation resulted in a lot of lives saved during the study, and then rolling this out would save hundreds of thousands of lives. So there's actually lots of now new innovations coming up that are online, ready to roll out. And the plastic drape is one. We now have something as simple as a single injection of IV iron given during pregnancy can cure anemia during pregnancy. AI-enabled ultrasound that can be used by frontline health workers will really revolutionize antenatal care and primary health care settings. So there's a lot of these things that we can do if we had the investment, both on the innovation side and on the delivery side, to really make a difference.
So in a simplistic sense, what I'm learning from you is that we are trying to put together a jigsaw of the money and really good ideas, sometimes simple ideas,
yes,
and work on the ground like we saw from women in that video.
If I can mention two initiatives that I'm really excited about. One is that we had the good fortune to launch a new alliance called the Global Alliance for Women's Health at WEF in January, which brings together multiple stakeholders from around the world, private sector, industry, public sector, to see what we can do for women's health. And the other is the Lives and Livelihoods Fund, which has been very generously supported for many years by the Kingdom of Saudi Arabia and other Gulf countries, which is now looking at how do we incorporate the gender lens into a lot of their investing so that we do not see the issue, that we can address the issues that we are talking about.
Yes. Thank you. Thank you very much. We're running out of time, unfortunately, for this part of the session. Yes, please, Prime Minister. But we have. Yeah. I'll give you a minute to solve the world's health.
There's no doubt that King Salman Foundation is doing a terrific job and providing all sort of help to suffering humanity, and my deep appreciation to my brother and, of course, His Majesty, whose this is a wonderful job being done. And then, of course, on polio, Pakistan is a great beneficiary of Bill Gates Foundation, and it has done a remarkable job over there. Of course, 50 million vaccines every year, and I think if I did not acknowledge Bill Gates' generosity here, I think I will not be fair to myself and fair to him. despite 2022 floods, which washed away large swaths of land, we were with great difficulty were able to vaccine children. But I think this cooperation goes, and I think one day soon we'll be over the hump.
Prime Minister, that is so hopeful. Thank you. And let's just take, we've got less than a minute, Dr. Tedros, but I couldn't have you on the stage without asking you that question, and you're going to not thank me for asking you in a short time to answer an impossible question. Do we have the capability to ensure that we don't see another pandemic, the like of which we saw while you were leading the World Health Organization?
Yeah, I think the answer to that is we're unprepared and we're still vulnerable to the same problem. But the good news is, based on the lessons learned, we're building something. For instance, we're trying to address the surveillance by building a collaborative intelligence and a mechanism to share pathogens so that can be used for research and development. And for countries who have potential, they're moving into production of the tools to address the equity problems. And there is a pandemic fund now created. The World Bank is running it, and WHO is part of the Secretariat. And there are many other initiatives that have started. This is really important. But the key is, how can we have a binding pandemic agreement that member states would respect? So if anything happens, first of all, the best is to prevent it, and that's why we're building capacity. But we need to have a binding agreement in order to prevent or to early detect and respond in a better way.
And that's what you're hoping for this year.
Exactly.
That's what you're hoping to see this year.
As we speak, member states are now negotiating.
Yes.
And I have been following the negotiation, and I'm hopeful that by May 2024 there will be a deal. And that will help us to prepare better and prevent the same thing with COVID, like COVID, from happening. But one thing I would like to underline is, there was a question, 30 seconds. There is a question that's asked many times, who has done well during this pandemic? Maybe as a group, the Mekong region did better. And the reason for that is they had muscle memory from 2003 SARS. Now, I think the whole world has the muscle memory, and hope they will use all their experience to prepare, especially the preparation and capacity at country level is the most important, to prepare and prevent the same thing from happening in the future, because the whole world has a muscle memory now.
A television reporter like me is constantly being told by producers to rap, so there's some enjoyment in having to do that to somebody else, but that's such an important message. Dr. Tedros, thank you very much. Excuse us now, we're going to have a little choreography. Please don't leave, the best part is coming. A news-making announcement is coming, but I'm going to ask you, Dr. Tedros, Prime Minister Sharif, and Anita Zaidi to leave the stage while we prepare for the next part of this presentation.